Good morning, everyone. Today is Tuesday, March 14, the year of our Lord 2023. The Insurance Committee of the Tennessee House of Representatives of the 113th General Assembly is now in session. Mr. Clerk, please call the roll.
Representatives Capley, Sapicki, Davis, Freeman, Haynes, Hemmer, Hicks, Johnson Montgomery, Johnson of Knox, Lafferty, Mitchell, Ritchie, Rudd, Rudder, Sparks, Terry, Thompson, Vice Chairman Martin, Chairman Kumar.
Here.
Mr. Chairman, you have a quorum.
Thank you. Members, welcome again. Do we have any personal orders? Chairman Lafferty, you're recognized.
Thank you, Mr. Chairman. I just wanted to recognize my old friend back there in the corner, Mr. Chris Talley. Welcome to the community, or to the committee today.
Chairman Hicks, you're recognized.
Thank you, Mr. Chairman. And I'd like to have those in the audience that are part of the Tennessee Association of Mental Health Organizations. Would you please stand and let us recognize you?
Chairman Martin.
Thank you, Mr. Chairman. I am honored to announce today for the first time in 40 years for our Chiropractic Day on the Hill, we have a chiropractor sitting on this panel. So today's Chiropractic Day on the Hill. If you guys would please stand in the back for us to recognize you guys. Thank y'all for your service. And I also have a group of constituents from Huntington that are with Cary Counseling today. So thank you guys as well for being here.
Well, among other days on the Hill, this is also, I understand, Tennessee Captive Insurance Association Day on the Hill. And we are honored to have Mr. Kevin Doherty and Mr. Tony Greer. Any other personal orders? Seeing none, we'll move on with our calendar. Just to announce, item 7 is rolled to 2 weeks. Our first bill on the calendar is House Bill 1503 by Chairman Wan. Thank you. We have a motion and second. We also have an amendment. It's 4950.
Yes, sir. We are on the same page. Chairman Doctor.
Thank you, sir. Members, can I have a motion and a second on the amendment? Let us attach the amendment to House Bill 1503. All those in favor, please say aye. Opposed? The amendment goes on the bill. Chairman Vaughn, you're recognized on the amended bill.
Thank you, Mr. Chairman. House Bill 1503, which is the Tennessee Surprise Billing Consumer Protection Act, seeks to provide methodology in which folks are protected from those surprise bills that show up in their mailbox following a visit to what they believe to be an in-network provider, yet someone provides them services through that provider that they themselves are out of network. It holds patients harmless in surprise billing situations, establishes an independent dispute resolution process for insurance companies and providers to work through these payments for out-of-network services that occur in network facilities, and we'll admit to the fact that we adopted some principles that Georgia had first put to try. Also, we're going to create a greater oversight of network adequacy standards, so the Department of Commerce and Insurance will also be involved in this. So want to make sure that folks know that TennCare is not a participant in this. This bill does not affect them. So with that, sir, I'll stand for any questioning.
Well, thank you. It's a fairly comprehensive piece of legislation and much needed. I think it's good to know and realize that the most important thing, patients will not be held responsible for any surprise bills beyond the deductible and copay that their inpatient network would have obligated them to. And I think that's an important thing. Members, do we have questions? Well, seeing none, are we ready to vote? Without objection, we are voting on House Bill 1503. All those in favor, please say aye. Aye. Opposed? The ayes prevail. The bill goes on to government operations.
Thank you, Chairman Doctor. Thank you, committee.
We'll see you there.
And with just a point, I've got a little catch, so I was wondering if I could show this thing to the Vice Chairman
The audience will be happy to see.
or anybody in the back here.
Thank you. Item 2, House Bill 1163 by Chairman Todd. I think he did tell me, come to think of it, that he has a bill in agriculture somewhere and he might be a bit late. So we will roll it until his arrival. Item 3 is House Bill 0607 by Representative Hale. Representative Hale, welcome. This is your first bill before this committee.
Yes, sir.
We have a motion and second on the bill, but we also have an amendment 4467.
That's correct.
We have a motion and a second on the amendment. All those in favor of attaching amendment 4467 to House Bill 0607, please say aye. Opposed? The amendment goes on the bill. Representative Hale, you're recognized on the amended bill.
Good morning, Mr. Chairman and committee, and thank you. House Bill 607 is a prior authorization for power and manual wheelchairs. This bill will prohibit insurance companies and TennCare from requiring prior authorization for repair of power and manual wheelchairs. This bill was brought to me by the Tennessee Disability Coalition on behalf of their members and constituents who have struggled to navigate this burdensome red tape. I can testify to that myself. I'm still waiting on tires and dealing with the insurance and stuff from back in January. So this has been very much an aggravating thing. The current requirements for prior authorization are unnecessary. They lead to long delays in repair of equipment and numerous negative outcomes for the people who use wheelchairs. These folks rely on this equipment to get around the community, sustain their care, go to work, and live independently. Prior authorization puts a pause on all of that. This bill would speed up the repair process and allow these people to get back to their lives. This bill targets a narrow window that a wheelchair typically has a 5-year lifespan. Most of the repairs that are done during the first 2 years are covered by the warranty. Then this is basically covering those years from year 2 to 4 or possibly the 5th year. This bill is not eliminating any prior authorization for the initial purchase or any replacement. It's only for the repair of the same equipment that has already received prior authorization when it was purchased in the first place. And I renew my motion.
Thank you, Representative Hale, and thank you for bringing this legislation, adding a personal narrative. Members, do we have questions for Representative Hale? We're really quiet today. The question's been called. Without objection, we are voting on House Bill 0607. All those in favor, please say aye.
Aye.
Opposed? The bill goes on to House Finance, Ways and Means Committee. Thank you.
Thank you, Chairman and committee.
No, it's Representative Hammer, you're recognized.
Thank you, Mr. Chairman. I'd like to recognize my nephew, Brady Mitchell, who's here today. He, for some reason, on spring break and thought this would be fun.
I think Brady is young, so he came late. Item number 4 on our agenda is House Bill 0493 by Speaker Johnson. We have a motion and a second, Speaker Johnson, and we have an amendment 4391.
4391, that is correct.
Members, can I have we have a motion and second on amendment 4391. All those in favor of attaching this amendment to House Bill 0493, please say aye.
Aye.
Opposed? The amendment goes on the bill. Mr. Speaker, you're recognized on the amended bill.
Thank you, Mr. Chairman. House Bill 493 extends the annual nursing home bed assessment until June 30th of 2024. This bill reduces the assessment on non-Medicaid facilities and private pay buildings from 3% to 2.75, and facilities receiving significant reimbursement from Medicaid will see an increase in the rate to help offset wage and other inflationary pressures. It will increase it from 4.75 to 6%. And I'm open for any questions.
Thank you. Thank you, Mr. Speaker. This is a much needed yearly bill that we do that helps funding of these facilities. Motion's been called without questions been called. Without objection, we are voting on House Bill 0493. All those in favor, please say aye. Aye. Opposed? The bill goes on to Finance, Ways and Means Committee. Item 5 on our agenda is House Bill 0498 by Vice Chairman Martin. We have a motion and a second, and I also see an amendment 4040. Let us attach the amendment 4040 to House Bill 0498. All those in favor, please say aye. Opposed? The amendment goes on the bill. Chairman Martin, you're recognized on the amended bill.
Thank you, Chairman and committee. This bill has two parts in regards to physician assistants and behavioral health services. Currently in Tennessee, 10 of the 12 visits can be done remotely from the collaborating physician with the provider. This bill first would allow all 12 visits to be done remotely. The reason of that aspect is because those providing solely telemedicine don't have a location. So it fixes a gray area to where the provider can meet collaboratively with him online. The second part of the change presents an exemption to the 16-month prior visit. So currently, to get mental health services, you got to be seen 16 months prior to that in person. This gives an exemption to speed up that process to where that first visit can be done virtually, and then the follow-up visit be in person. So the importance of that is reducing the barrier and getting those patients that need the care and the access to it quicker on that second part of that. So I stand ready for question.
Well, thank you. Members, do we have questions for Chairman Martin? Seeing none and without objection, we are voting on House Bill 0498. All those in favor, please say aye. Aye. Opposed? The bill moves on to Full Health Committee.
Thank you, Chairman.
Thank you. Okay, you want to pass the gavel to him?
Perfect. That brings us to item number 6, House Bill 1309. Got a motion and a second. Chairman Kumar, you are recognized.
Thank you, Mr. Chair. I think the amendment has already been attached in the subcommittee. No, it has not? Okay, so we have amendment number 2904.
We're not finding an amendment to that, Chairman.
I have 2904.
Yeah, we're on 1309. That might be the other
The
one.
House bill is 1309. Yeah. What do you have?
This bill here,
Right.
that you're talking about. I think the amendment you called out was on 1318.
And what's the amendment? And there's no amendment to it. Okay. Hold on, yes. Well, Mr. Chairman, original bill,
Yes, sir.
barcode on it is 2904, but I'm presenting House Bill 1309.
Yes, sir.
And Thank you.
Chairman, your mic, please. Your mic's on. Thank you.
There is more confusion than usual. Members, we know we are all products of our genetic lottery, and that determines what we look like, how we act, how we behave, and how confused we get at times. Our genes and genetic makeup can predict our future and our health. And since the human genome has now been mapped fully, it is possible to predict those things. And the problem with that is that that future knowledge can affect our lives, including how we buy life insurance. And can the life insurance companies look at into the window of the future and rate us accordingly? The Genetic Information Non-Discrimination Act avoids that and makes it possible that we are not penalized for the genes that we inherited. According to this bill, an insurance company will not deny insurance based on genetic information, purchase genetic information about a member who has applied for insurance, require an applicant to take testing to determine their genetic makeup, and will not access genetic information of the applicant who has applied for life insurance. If some information is included in the person's medical record as they obtain it, then that can be used because that is open knowledge. So the purpose of this bill is to avoid genetic information misuse and non-discrimination based on our genetic behavior in purchase of life insurance. With that, Mr. Chairman, I renew my motion.
Thank you, Mr. Chairman. Members, are there any questions for the sponsor? Representative Ritchie, you're recognized.
Thank you, Chairman. Thank you, sponsor, for this particular bill. You mentioned that the DNA can set up or predict future health. And when we're looking at insurance companies doing their mortality tables and calculating all this stuff, in a situation where a consumer is going to get this from an individual company, those companies are putting best practices and procedures in place to be able to make sure that they can pay out on all these claims that come up in the future. And I would think that this would be a good resource for these insurance carriers to be able to calculate more accurately what the actual cost for that particular benefit would be. So I've got a lot of concerns with the language and the conversation point of why it would not be allowed. It is speaking directly towards why it should be available. A lot of legislation comes through here, and we say that we're not going to end up putting restrictions or policies in place when it comes to individual businesses. And I feel that this is directly doing that. And I don't think that this would be needed regulation. So unfortunately, I'm not going to be supporting this. Thank you.
Thank you.
Thank you, Representative. Representative Freeman, you're recognized.
Thank you, Mr. Chairman. I just want to make sure that I heard you correctly. So if someone goes to a third-party genetic testing, that information is not going to be able to be used against them in the pricing or exclusion of life insurance. But if they do a test, it can be used against them. Why not just include DNA testing and results cannot be used to affect pricing I mean, just across the board? That would make more sense. Why the specific exclusion?
Chairman, you're recognized.
Yes, thank you. That's a good question, and that's a difficult thing to determine. What this bill says is that the insurance company will not purchase genetic information on an applicant. So they cannot go to third-party testers and get that information. They will not require a person to take genetic information that can be used for determining longevity. And they will, but on the other hand, they do have the ability, or they do have the right to request a medical record. If a piece of information is in the medical record, that is basically knowledge, because let us say a person has certain testing done for breast cancer and they are breast cancer patient already. So that knowledge is already available to them. So it's not that information, any genetic information that is openly included in a medical record is going to come with the knowledge that that entity or that disease exists. So that it's difficult to exclude that.
Representative Freeman, you're recognized.
Yeah, I just want to clarify, when you get a genetic test, it gives that you have a higher chance of getting a disease, not that you're going to get the disease. So I just want to make that one point. I have a real issue with that, because if someone is taking their health seriously and they decide to get a genetic test, you now have an insurance company that could theoretically use it against them, but yet we're telling them that they can't use that information if they get it from a third party or buy it from I don't know where you buy DNA evidence from. That seems odd, but, or that you can, or that they can't force you to do it. But if you do it on your own free will, would you be open to rolling this a week and adding that they can't use DNA data at all? You said it's against the law. We make laws here.
Chairman, you're recognized.
When a person independently, privately gets third-party testing from 23andMe or Ancestry, and they get genetic information, that information is not a part of their medical record. That is their personal information, they keep it, and those companies guard it. Actually, this is GINA, Genetic Information Non-Discrimination Act. There is a second act that I'll be bringing next week to satisfy your concerns, and that is Genetic Information Privacy Act, GIPA. And in that, the third-party testing companies are prohibited from revealing that information, and that protects that information completely. So these are two separate bills. I didn't want to combine them because it became a little too bulky of a bill.
Representative Freeman.
Yeah, I appreciate that, and look forward to your other cleverly named bill next week.
Thank you.
Thank you. Representative Mitchell, you're recognized.
Yeah, thank you, Mr. Chairman. Chairman, so if it's part of the medical record, it's discoverable for the insurance carrier. And I understand that. I'm just trying to, there's nothing else ever by law been excluded from a medical record that they couldn't use, correct?
That is true. It will be very subjective effort that insurance companies ask for medical records. Medical records are going to be sent. Now, who censors them? What goes or what doesn't go? What does not go? So the total package is sent. That is.
So we're just keeping it. Like you said, nothing's ever been excluded. Before. So you're just keeping it as it's always been.
True.
With this. Thank you.
Representative Hemmer, you're recognized.
Thank you, Mr. Chairman. Thank you, Chairman, for bringing this bill. Maybe I'm a little sensitive to it because I've been filling out a 30-page life insurance form, but also as a former cancer patient, it's why I'm having to do a lot of the extra steps. And I share a representative colleague from Davidson County concerns as well, because I've had to do a lot of genetic testing. I've had to include that medical record. Also have a family history of cancer from my father and grandfather have had a particular kind of cancer. So I've included that in my medical record just so physicians are aware, and had genetic testing around that. I don't have that cancer, luckily, but predisposed to it. And so I'm a little sensitive to that topic. Now he brought that up, but I get what you're trying to do. I look forward to seeing the other bill as well. Thank you.
Thank you.
Yeah, Chairman Terry, you're here recognized.
Thank you. And I just trying to, and I appreciate you bringing the bill, and I was trying to figure out some logistics of this. And as a third party, and you're talking about bringing another bill, would you, like for instance, the genetic marker HLA-B27 for rheumatoid arthritis, ankylosing spondylitis, all that, would you imagine somebody sending somebody out to a third party to get tested, and then that, they're tested at a third party, and then all of a sudden that information is no longer available to be used? But if that third party sends it back to the doctor that ordered the test, now it's used? I'm a little bit confused.
Chairman Kumar, you're recognized.
Yes, I think you are interpreting it correctly in the sense that if you go to a private third party of your own accord and privately have any genetic testing done that is not to be discovered or available to an insurance company. On the other hand, as you mentioned, rheumatoid arthritis, if you have rheumatoid arthritis and then testing is done, now the rheumatoid arthritis is already in your medical records. And then when it comes back to medical record, it adds very little more because that is already known.
All right. Thank you.
Anything else? Cool. Seeing no further questions. Nope. Representative Ritchie, you're recognized.
Thank you, Chairman. I just have one follow-up question. So going back off of my colleague was mentioning, in this particular language, would it preclude an insurance carrier from putting the question on there if there had been any genetic testing or something done through a different provider? So in that example that was just shared, to where it might not be at their primary physician, but it could be somewhere else, would this end up precluding them from that being on there to be able to then retrieve that data? I'm just looking at this from protecting these carriers that have to pay out billions of dollars in death benefits every year when it comes to life insurance, for example. And just want to make sure that we're not taking it and cutting off their nose to spite their face, so to speak, with this particular piece.
Chairman, you're recognized.
Yes, these bill and the provisions prohibit an insurance company from asking an applicant about any genetic testing that they have done.
Any further questions? Seeing no further questions, no objections. All those in favor of sending House Bill 1309 to calendar and rules signify by saying aye. All those opposed say no. Ayes have it.
Thank you, Mr. Chairman and
HB
committee.
1309 moves on to calendar and rules. Those that voted no would like to be recorded as a no. Please see the clerk. That brings us to, oh, you're good.
Have we tried to reach him? We have not.
He's an ex-sub, and I was kindly got an email saying they're on their file, but I don't see him anywhere.
Oh, we'll take a 5-minute recess.
5-minute recess.
What time is it? We have time. 11:03. Members, Chairman Todd is still not here. He's occupied another committee. Let us take a 5-minute recess. He will appreciate our cooperative behavior. You want to try to reach him? Go find him?
His assistant, he said that he's in ag still, and they're finishing up.
You want to go ask him, does he want us to roll it, or does he?
Yeah. That amendment, we didn't even put it on for subcommittee. I don't know where, I don't have it.
I was confused. It's not an amendment. The barcode of the Well, thank you. The Insurance Committee of the Tennessee House of Representatives of the 113th General Assembly is back in session. Uh, The pending item is item number 2, House Bill 1163 by Chairman Todd. We have a motion and a second. Chairman Todd, we have an amendment 4674.
That is correct.
Yeah, we have an amendment, motion and a second. All those in favor of attaching Amendment 4674 to House Bill 1163, please say aye. Opposed? The amendment goes on the bill. And Mr. Chairman, you recognized on the amended House Bill 1163.
Thank you, Mr. Chairman and committee. I appreciate your patience while I left another committee briefly to come over here and meet with you. This bill preserves the healthcare sharing ministries as a viable choice for Tennesseans who are seeking a healthcare solution that is consistent with their religious beliefs. It clarifies for consumers that HCSMs are not insurance. It ensures that HCSMs are being held accountable to the Attorney General and subject to regulations. These safe harbor laws exist in 31 other states, and I'm bringing this as a part of the American Legislative Exchange Council's model policy that was vetted by ALEC and many of its members. And so I'd be glad to take any questions, but obviously I gave a lot of details in subcommittee, and I'll spare you that unless you want some answers to some specifics. Thank you, Mr. Chairman.
Thank you. Well, certainly I admire you for bringing legislation that brings people together, creates a sense of community, and they help each other. Members, do we have questions? Well, thank you. Questions been called. We did have a gentleman who might have traveled to testify. Is Mr. Noble still here? Representative Mitchell, if you don't mind, let's allow Mr. Noble to testify. Mr. Noble, you did this in subcommittee, so you're familiar with the parade. And thank you for coming. You have 3 minutes.
All right. Thank you, Mr. Chairman, members of the committee. My name is Joel Noble. I'm here from Peoria, Illinois, representing Samaritan Ministries as their Director of Public Policy.
Mr. Noble, forgive me, I forgot a part of my housekeeping. We have to go out of session to allow you to do that. We are out of session. Now you can start.
Okay. Thank you again. My name is still Joel Noble, and I'm still from Peoria, Illinois. I'm here representing Samaritan Ministries. I'm the Director of Public Policy. Samaritan is one of the 3 largest healthcare sharing ministries in the nation. I'll be brief. I'll try not to rehash much of what I said in subcommittee. But for those of you not in the subcommittee, for over 27 years, Samaritan has been serving its members as Christians bear each other's burdens through healthcare sharing. That includes over 8,800 individuals here in Tennessee. I've been blessed to have been serving with Samaritan for the last 20 years in the healthcare sharing field. As was stated, HB 1163 as amended will remove any question that may arise in the future by recognizing that healthcare sharing ministries do not constitute the transaction of insurance business in Tennessee. So explicitly clarifying that healthcare sharing ministries are not subject to the insurance code does not remove consumer protection, but rather will eliminate any confusion to the jurisdiction, and as ministries, they're subject to the laws applicable to charities enforced by the Attorney General. Healthcare sharing ministries have been formed to meet the healthcare costs of the members by sharing funds voluntarily among other members. So let me give you a functional example from my own life. So over the last 22 years, I've not had insurance, and I've been with Samaritan. Had many needs during that time, including the birth of my 4 sons. I'm also privileged to have one of them, my 14-year-old, sitting behind me. He traveled down with me last night from Peoria to join me here. So when we were expecting him, we went to my wife's doctor and also went ahead of time to the hospital. and they had a self-pay program there. They called it the Stork Broker. And as long as you paid before the birth, it was, I believe at that time, $3,200. So I got that contract from them. I turned it into Samaritan along with the bills from my wife's doctor. And then other members were assigned to send to me. I got about a dozen checks in the mail from all over the country, cashed those checks, and went and paid the providers for that need. And each month, as a member, I'm assigned somebody that had a medical need. For my family of 6, it's currently at $365. I know each month I'm going to be sending that to another person that had a medical need. I know how to pray for them. I send a note of encouragement, and I either write a check or I go on to one of the electronic bill paying like PayPal and send that directly to them. So that's how Samaritan works. There's other ministries, other national ministries that do it a little bit more sophisticated. Electronically, it's not the check to check like we do, but it's all direct share. So member to member, the money's not coming into the ministry for needs, and there's no pooling going on with the ministries at Samaritan or any of the other ministries that are part of the Alliance of Healthcare Sharing Ministries, our trade association. And so I would just ask that you support HB 1163, which will explicitly clarify the nature of healthcare sharing ministries as ministries and not insurance. I'd be happy to answer any of the questions you have.
Thank you, Mr. Noble. Members, do we have questions for Mr. Noble? Representative Hammer, you're recognized.
Thank you, Chairman. Thank you for coming here today and your explanation. Just curious, do you keep track of the claims that are not paid, or are there claims that are not paid as part of your organization?
Thank you, Mr. Chairman.
You're recognized.
We do have guidelines. There are needs that could be sent in that would be outside those guidelines. The members would be aware of that. Sometimes we ask that the bills be itemized. Sometimes the need would be held up. If we can understand the need, we would ask the member to get an itemized bill, send it in. But yes, there could be needs that would fall outside the guidelines of what would be shareable.
Mentioned earlier in the other testimony, I'm previously a cancer survivor. I had a 2-time Hodgkin's lymphoma survivor, and I had a high-dose chemo stem cell transplant. My bill was over $1 million. If I was a member of your organization, would that be within or outside of your guidelines?
Thank you, Mr. Chairman. That would be something that would be shareable. I believe I'd have to look. I think the largest need to date is a preemie baby in Oregon. It was well over 2 million. I think it's coming down, but yes, needs that large are shared and have been shared in the past.
Okay, thank you.
Well, that's remarkable. I had in subcommittee mentioned the possibility of considering a catastrophic health insurance for very large needs, but I think you're managing things well. Members, any other questions? Representative Mitchell?
Yes, sir. Thank you, Mr. Chair. So do you reach out to certain health networks or health, hospital groups to kind of like reference-based pricing will give you X amount, kind of like you just said, the cost of that premium is coming down. So do y'all do that?
Yeah. Thank you, Mr. Chairman. We work with providers. A lot of it is the members working themselves. We do have a resource called Healthcare Blue Book, just like Kelly Blue Book, where you can determine the cost of a car or an automobile. This shows you a fair price and also the ratings for different providers. That gives an idea of what a fair price is. Our provider relations department at Samaritan will also work with providers. It just really depends on the provider. I'll mention that his younger brother, when he was born, it was $3,600. That hospital system was bought out by another hospital system. I received a bill 2 weeks later for $13,000. And so that's what they were going to charge me without the self-pay. Worked it out, brought it down. So that's just an example of
Representative Mitchell?
Yeah. So do y'all guarantee payment in a certain period of time?
So since we're not insurance, there is no guarantee. The members understand that they're ultimately responsible for their
Yeah.
bills. But we share between 30 and 60 days a need. The difference in that time frame is depending on when it's received. So if a need was received in March 31st, that's going to be shared in May. That's closer to 60 days. If that same need came in a day later on May 1st, that would be shared. No, April 1st, sorry. That would be shared in June, closer to 60 days. So it just depends on when in the month we receive it, but 30 to 60 days.
All right, thank you.
Any other questions, members? Seeing none, we'll go back into session. Any other questions for Chairman Todd? Questions been called, this time for real. All those in favor of House Bill 1163, please say aye. Aye. Opposed? The bill goes on to calendar and rules. Members, seeing no other business, we stand adjourned. All right.